Good evening. Good evening to one and all. And I thank you all for taking the time and joining us for this webinar on Sunkalp. Before we start, let me introduce myself. I'm Dr. Sanjay Chaudhary and I'm part of the medical affairs team from Sun Pharma. It gives me an immense pleasure to extend to you all a very warm welcome on behalf of Sun Pharma to this Sunkalp initiative, which is a multifaceted initiative and a commitment from Sun Pharma for the welfare of doctors, their families, and communities at large. We all know that last 1 year has been a tough one for everyone. COVID-19 has affected almost everyone's life and has changed the way we live. So, in our fight against the pandemic, doctors and healthcare professionals have been lifeline to many during this period. Despite the risk to their health and safety of loved ones is an inspiration to all. On July 1st, as India celebrated Doctors' Day, the Sun family launched Sunkalp, an initiative for the welfare of doctors, their families, and the community in India. Sunkalp is a tribute to these heroes for their selfless act of sacrifice and kindness. To know more about this initiative, we would take you all through a small video.
Oxygen levels are dropping drastically. Take it slow. Patient coming in is 40 years old with 100 degrees.
Who is she?
My wife.
Mom, my best friend.
My guide. My daughter-in-law.
My child.
A doctor's smile sparks off 100 smiles. And as a promise to keep their smiles going, this Doctor's Day, Sun Pharma is proud to introduce Sunkalp, an initiative dedicated to doctors, donation of COVID-19 medicines, educational aid for doctors' children, postdoctorate educational sponsorship, mental health support for doctors. Sun Pharma, reaching people, touching lives.
So as presented in the video, Sunkalp initiative, it covers mostly two aspects: mental health webinars and mental health counseling. So today we are connecting in reference with this. So as part of these initiatives, we'll be having a series of webinars planned to educate clinicians and their families associated with COVID duties with evidence and practice-based medicine by sharing quick solutions for managing mental health issues. The sessions will include real-life case studies and offer practical tips for the well-being and enable them to take better self-care and provide effective patient care. Sun Pharma has specially curated the panels of speakers to bring expertise from the field of national disasters like earthquakes, cyclones, droughts, and more importantly, COVID-19. So to know more, you can log on, you can visit the sunpharmasunkalp.com. So as promised, today we have our second webinar on mental health for doctors. The topic for today's session is post-COVID depression and COVID phobia. And I'm very much fortunate to introduce our guest speaker for today, who is a renowned psychiatrist with extensive experience in the field of mental health, especially in connection with disasters, Dr. Nilesh Shah, sir. So this is the short CV of Dr. Nilesh Shah, sir. So these are some of the key achievements as per sir. Sir has been a class monitor in the 3rd standard. Sir has won 3rd prize in the running competition in the 6th standard. Sir has also been a part of drama in 9th standard. And presently, sir is working at Sion Hospital, Mumbai as a full-timer since 1988. And as per sir, he joined this as he did not get any attachment at any other hospital as a consultant. Sir likes to watch Hindi movies, traveling, and roadside food. Sir is married and has twin daughters. Sir has a pre-morbid personality and over anxious. So please help me in welcoming the eminent personality, Dr. Nilesh Shah, sir, who has dedicated his life for the welfare, emotional well-being, and safety of others. It is really our privilege and honor to have you here, sir. And now I would request you to please take over and enlighten us. So today, sir is going to present two real-life case studies, one based on the physician and one based on the cardiologist. Over to you, sir. And welcome to the Sunkalp webinar once again, sir, on behalf of everyone.
Thank you, Dr. Sanjay Chaudhary, and thanks to Team Sunkalp and Sun Pharma for inviting me and giving me this opportunity to make a presentation on this very important topic of what we are all concerned about is post-COVID depression and COVID phobia. As Dr. Sanjay Chaudhary mentioned, I'm going to present two cases, one of post-COVID depression and another is COVID phobia. And after that, if time permits, we can have question answers. So let us start with this first case of post-COVID depression. This is the case of a COVID-19 warrior, a 40-year-old doctor, and he was obviously, like many of us, was a COVID-19 warrior. He worked very hard and helped a large number of COVID-19 patients during pandemic. But unfortunately, he developed COVID-19. He had to be in ICU for about a week as he had cytokine storm. He gradually recovered from COVID-19 and he started his practice again after about a month of this illness. He came to me with complaints of sleep disturbances and particularly early morning insomnia. Now, this symptom is very important, and any psychiatric disorder, the most common symptom is sleep disturbances. Like for medical illness, fever and pain, they are the two important symptoms. Similarly, for psychiatric disorders, insomnia or sleep disturbances and mental pain are the most important symptoms. And when there is an endogenous depression, you get this early morning insomnia. So he would be able to fall asleep at his usual time of 11 p.m. But instead of waking up at 7 o'clock in the morning, he would wake up at 4 o'clock in the morning. And then he wouldn't know what to do at 4 o'clock in the morning because other family members would be sleeping. And he couldn't switch on the TV or radio or mobile as other members will get disturbed. And for 2 to 3 hours, he would feel miserable, lying in the bed, not doing anything and not able to sleep also. He also complained of feeling sad, depressed, and occasional crying spells. He said that he is now old and mature and he has not cried in many years. But now, over a trivial matter, something happens and he starts crying and he doesn't know why. He is unable to stop crying. He had also observed diurnal variation in the mood. So when he would wake up in the morning, the sadness would be maximum. He will not be able to do anything. It will be a great effort to come out of the bed. He had to literally push himself to come out of the bed, and he would feel terribly depressed in the morning. Brushing his teeth, taking his bath, getting ready for work would be an effort. And with lots of effort, he will have to do all these things. So feeling sad in the morning, and then as the day progresses, in the evening, he would be relatively better. The depression would be less. And again, this is a very typical symptom of what we call endogenous depression or major depression with melancholia. And a third and very important symptom, loss of pleasure in day-to-day activities. Earlier, he used to enjoy his food, enjoy meeting his friends, enjoy watching TV shows which he liked. But now, he said, I don't get pleasure in day-to-day activities which he used to enjoy earlier. Also, as far as work was concerned, he had a decreased energy and easy fatigability. And this happens to many people after the COVID illness. Easy fatigability. You get very, very tired easily. Even if you walk for a while, you get tired. If you climb a staircase, you feel tired. And he would get easily tired. Earlier, he used to see 30, 40, 50 cases in a day without getting tired. But now, after seeing 5 to 10 cases, he would feel tired. And now he started worrying about his future. That now this is a situation he is not able to have a proper attention, concentration at his work. And now he's feeling anxious all the time. And he started worrying that what will happen to his career if he's not able to see the patients properly, and what will happen in future. So there was a decreased confidence. Earlier, any patient he would be able to treat properly, he would be able to write medicines with confidence, and he would be able to assure the patient that not to worry and the patient will recover. But now he himself had loss of confidence, and sometimes he had to scratch his head to remember what drug to prescribe, which medicines, and how it is to be prescribed. And also occasionally he started getting negative thoughts, like whether the life is worth living, what is the point in this life, etc., etc. Life not worth living amounts to suicidal ideation. We call it passive suicidal ideation, and this is the beginning where depression is becoming more and more severe. Obviously, these are all the symptoms of depression, and this is what we call post-COVID depression or post-viral infection depression. He had all the symptoms of depression, and we have seen quite a few patients who develop depressive symptoms or depression after any viral infection, or for that matter, any febrile illness. So it is also called as post-febrile illness depression. What is happening is probably because of viral infection, because of febrile illness, the serotonin level in the brain, which is necessary, the optimum level of serotonin is necessary for our mood. And there is a decrease in serotonin level in the brain. And that's why people feel low, depressed after any febrile illness or viral infection, or particularly in this case, after the COVID illness. So the diagnosis was post-COVID depression. One of the most widely used drugs nowadays are selective serotonin reuptake inhibitors, what we call SSRIs. And any of the SSRIs one can use. In this particular case, we used escitalopram. We usually start with 10 milligram dose at bedtime after dinner. And because he also complained of sleep disturbances, early morning insomnia, we added 0.5 milligram of clonazepam at bedtime. Escitalopram, the dose varies from 5 milligram to 20 milligram. So if necessary, you can increase it to 20 milligram. And if the person feels that 10 milligram is little more, in elderly people or children, you can start with 5 milligram. Again, clonazepam, again, it is available as 0.25, 0.5 milligram tablets. And most of the people do well with 0.5 milligram tablets. But if it is more, then it can be reduced to 0.25 milligram of tablet. After starting the medicines, gradually over a period of next 2 to 3 weeks, he started feeling better and completely recovered from his depressive symptoms over a period of 12 weeks. This is again important to note that the recovery doesn't occur immediately. Once we start these medicines, gradually serotonin level increases in the brain, and there is a post-synaptic down-regulation of serotonergic receptors. Because during depression, there is an upregulation of serotonin receptors, and once you treat over a period of 2 to 3 weeks, the person starts feeling better. And over a period of 8 to 12 weeks, when there is a down-regulation of post-synaptic serotonergic receptors, the person starts feeling better. So majority of the patients with this treatment recover over a period of 8 to 12 weeks. Now he has again started working hard and is helping COVID patients. So again, he has become a COVID warrior. So one of the most common psychiatric disorder is depression, and we call it a major depression. And not only after COVID or viral infection or a febrile illness you develop depression, but depression may be associated with number of other conditions. One of the common depression which we see is postpartum depression after delivery. Serotonin and estrogens are sisters. So whenever there is a drop in estrogen level, say for example, premenstrual period, there is a drop in estrogen level. Menopause, there is a drop in estrogen level. And in postpartum period, there is sudden drop in estrogen level. And whenever there is a drop in estrogen level, usually even serotonin level drops. And women are at a higher risk of developing mood changes and depression. So postpartum blues, postpartum depression is very common, which you see in postpartum period. Post-myocardial infarction depression. We regularly get cases that after heart attack, the cardiologist says he's absolutely fine, there are no problems, but the patient has symptoms of depression. A very well-known phenomenon is post-stroke depression. Almost 30 to 40% of the patients after stroke may develop depression, and because of the depression, they may not take medicines regularly, they may not do physiotherapy regularly, and as a result, their prognosis may be affected. So if we identify post-stroke depression and treat that post-stroke depression, the patient will improve from depression, will take medicines properly, and also do the exercise properly, physiotherapy properly, and he will recover rapidly. We have seen depression in patients with tuberculosis. We regularly see patients with depression in patients who have HIV and AIDS. Almost 1/3 of the patients with tuberculosis and HIV, AIDS, cancer develop depression. Those patients who are suffering from alcohol use disorder or cannabis use disorder, they are at a high risk of developing depression. And either when they are taking or when they stop, they abstain from alcohol and drugs, at that time also they may develop depression. And when we are pointing fingers to everyone else, even our own medicines can cause depression. Many of our medicines, psychiatric medicines, and particularly interferons, which we use for hepatitis treatment, can cause depression. Even certain tuberculosis medicines can cause depression. So if the patient develops depressive symptoms, we have to be vigilant, pick up these symptoms of depression and treat the depression which is associated with COVID-19 illness or in post-COVID depression or any other medical illness after which the patient develops depression. My second case is COVID phobia. Again, this is a case of COVID-19 warrior. We had this 28-year-old assistant professor of cardiology. He was asked to take leave for 3 days as he complained feeling very weak and tired after heavy emergency duty. So in cardiology, he had a very heavy emergency duty and then he was feeling very tired. So the professor said that why don't you take rest, take a leave for 3 days and then recover and then you join back. Now, COVID period was going on, and during his leave period, he started reading about COVID and then started feeling that he may be suffering from COVID. We all know this phenomena very well. When we were our MBBS students, we used to open a book and read some chapter, and then we would feel, oh, even I have these symptoms, I am also suffering from this illness. And during COVID period, we were bombarded with information related to COVID. You take your mobile and open WhatsApp and all the messages are related to COVID. You switch on TV and COVID. You switch on radio and there is a news on COVID. How many cases? You open a newspaper and so many cases of COVID recovered and what complications of COVID and all those things you keep on reading. And even if you call somebody, then in the beginning, there are precautions for COVID before you can talk to the other person. So he was bombarded with COVID information, and he also thought that because he has 3 days leave and nothing else to do, he should read more and more on COVID. And as he started reading more and more COVID, he started feeling that this weakness or fatigue which he was feeling was actually because of the COVID. So to be on safe side, he became so anxious that he got himself tested for COVID 3 times in 3 different laboratories on 3 consecutive days, because he had read somewhere that it can be false negative. So he may be having COVID, but then it may turn out to be negative because this test have some 70% sensitivity or 80 or 90% sensitivity. And in the first test, it may not be picked up. So his anxiety went on increasing, and he started feeling that he has COVID, and continuously 24 hours he was thinking about COVID. Now the thing was that in spite of negative reports from 3 different laboratories on 3 different days, he could not convince himself that he is not suffering from COVID. So he came to me and he said he kept on feeling very anxious, was worried that his reports may be wrong, and was most of the time preoccupied with COVID-related thoughts, and kept on reading more and more about COVID and coronavirus. He said he tried to relax, but he could not. He tried to fall asleep, but he could not. He tried not to think about COVID, but he could not. 24 hours round the clock, that COVID kept on moving in his mind. And he had terrible times and constant fear that he is having a COVID. And that's why he isolated himself, thinking that he will pass it to his colleagues, he can pass it on to his family members, and severe COVID phobia he developed. So fear of having an illness in spite of the contrary evidence. Now, we all feel anxious, we are all worried, and that is a good thing. What we call normal physiological worries, normal physiological anxiety, and that is good anxiety which will protect us from COVID. All of us should have this normal physiological anxiety because it will help us. Because we are a little anxious, because we are a little worried, we will take all the precautions to save ourselves from this COVID. We will wear mask, we will wash our hands regularly, and we will maintain social distancing. And whatever health related measures we have to take, we will take. And normal anxiety is very, very necessary for all of us. But sometimes we get overwhelmed by the anxiety, excessive anxiety, irrational anxiety, pathological overwhelming anxiety, and then gradually it becomes a obsessive preoccupation that you constantly, you know that I should not be thinking about it, but still that thought doesn't go away. It keeps on moving in your mind like an automatic negative thoughts. So it's called ANTS, automatic negative thoughts. So mungiye. Negative thoughts keep on coming to your mind. You try to stop them, but it doesn't go away. And then it becomes an irrational fear with avoidance behavior. So he isolated himself, he stopped meeting his friends, he stopped meeting his relatives, and in spite of the contrary evidence. So this is irrational fear with avoidance behavior, phobia. And because phobia is of medical illness, it is called illness anxiety disorder. We call it illness anxiety disorder or illness phobia. And in this particular case, the illness is COVID-19. So COVID-19 phobia. Sometimes this irrational fear can go into a delusion where it becomes a fixed, firm, unshakable belief, not shared by the other people in the community. He becomes deluded and thinks that he is suffering from COVID in spite of the contrary evidence, in spite of people telling him, doctors telling him, reports showing negative reports, X-ray chest, CT scan chest, everything being normal, still the person feels. So he becomes deluded, where it becomes a delusional disorder. So obviously his diagnosis was COVID phobia or illness anxiety disorder. In this kind of situation, you can either use escitalopram, which we had used in depression. Escitalopram also helps in anxiety disorder, or if you have a panic attacks, then one may prefer to use paroxetine. Again, it is an SSRI, selective serotonin reuptake inhibitor, and you can start with 12.5, go up to 25, or even 37.5 milligram tablets are available. Along with paroxetine, which we give usually at bedtime after dinner, we also give sustained release alprazolam to take care of very severe anxiety. So when there is a severe overwhelming anxiety and person is not able to relax, then it may be a good idea to give some anti-anxiety medicines along with paroxetine. As I told you, SSRIs do not work on day one, but it may work over a period of 2 to 3 weeks, and maximum improvement will be seen after 8 to 12 weeks. And that's why if you give clonazepam or alprazolam, immediately on very first day, the person starts sleeping well and anxiety reduces. And once the patient has improved, if necessary, you can put the patient on maintenance dose for 8 to 12 weeks and then gradually wean him off of these medicines. Clonazepam and alprazolam can be weaned off after 1 month if they are not necessary, gradually reduce and stop. And SSRIs can be weaned off after 12 to 24 weeks, depending on the case. So with the treatment, his sleep improved, fear and preoccupation decreased. He could resume on his duty after about a week of treatment, and now he has completely recovered and he no longer has this illness, anxiety, phobia. This is not a new phenomenon. It is not only for COVID. Earlier, 50 years, 60 years back, in 50s and 60s, 1950s, 60s, when tuberculosis was a new illness and we did not have many treatment for tuberculosis, people had tuberculosis phobia. Nowadays, what has happened? Earlier, गले में खिंच गले में क्या करूं? People would say, Vicks की गोली लो, खिंच दूर करो. Now, if there is a गले में खिंच, you say गले में खिंच क्या करूं? People will not say Vicks की गोली लो. People will say COVID के लिए टेस्ट करो. Similarly, earlier there was a TB phobia. So little cough, little weight loss, little weakness, and people think मुझे तो TB की बीमारी हो गई है. After we found a treatment for TB became treatable illness. There was no longer a fear of TB. Then came a period of cancer phobia. And I remember there was spate of Hindi movies related to cancer. We had a Safar where Rajesh Khanna develops cancer. Then Milli, in which Jaya Bhaduri develops cancer. Then we had Akhyo Ke Zaroke Se. Number of movies one by one in which the hero or heroine develops cancer. And then typical movie, in the first half of the movie, before the interval, there is a hero, heroine, they fall in love, they go to the garden, sing songs, go behind the tree. And this goes on, fun, happy moments. And just 5 minutes before the interval, something will happen to heroine, either a pain or fainting or something, and they will take him to the doctor, and doctor very seriously announce, इसे तो कैंसर की बीमारी हो गई है. And then music, and then interval. And then they keep you in suspense when you are having your samosas and popcorns during interval. And after that, rona dhona chalu, serious moments, crying, and then what to do. And then either in the end, the hero or heroine will die, or they will leave you in suspense and they will go abroad to take the treatment, and then you have to guess what happens to. If you are a optimistic person, you will say, they will go abroad, some treatment will be done and they will recover. After that cancer phobia, we had a period of heart attack phobia. Everybody talking about heart attack, everybody started what we call cardiac neurosis, and little pain in the chest, people would think they have a heart attack. They would go to doctor, cardiologist repeatedly. They will be assured that they do not have any cardiac illness. Angiogram will be done, but still they will not believe, and they will start behaving as if they have a cardiac problem. They will carry sorbitrate in their pocket, walk slowly, will not climb staircase, and all the time say, "Mujhe heart ki bimari hai, heart ki bimari hai," when there is no evidence of heart illness. And just before this, 10 years back, 15 years back, HIV/AIDS came, and we had quite a few patients of HIV/AIDS phobia. I still remember one counselor who was working with HIV/AIDS patients. He said in 1 year he got himself tested 40 times for HIV. 40 times, because every time something will happen, he will think कि मुझे HIV की बीमारी हो गई. He will go and get himself tested. If it is negative, his anxiety will decrease. And all the time, for any symptoms, cough, weight loss, diarrhea, anything symptoms happens, he will think he has HIV/AIDS phobia. And now the same illness anxiety disorder, the illness has changed from TB to cancer to heart attack to HIV. Now we have COVID phobia. So this is also disorder, and it is important that we recognize patients having COVID phobia. Normal anxiety is fine, normal worries are fine. But if there is an excessive COVID related anxiety, then yes, we have to identify and treat this illness. So remember, if somebody has feeling of ना कोई उमंग है, ना कोई तरंग है, मेरी जिंदगी है क्या एक कटी पतंग है, if you start feeling like that, or anybody starts feeling like that, then probably he is suffering from depression. And if you have severe irrational anxiety, overwhelming anxiety, he may be suffering from anxiety disorder. And for both depression and anxiety disorder, treatment is available. Along with medicines, there are other treatment modalities: exercise, socializing, extracurricular activities, and counseling. All these other methods help along with medicines, and we should, depending on the severity of illness, use these treatment modalities to help these patients. Thank you very much.
Thank you, sir. Thank you for taking us through important topics, that is COVID-related depression and phobia in the present, which are highly relevant in this scenario, and also taking us through these topics in a case study format, which are real-life case studies. Thank you, sir. Sir, we have a lot of questions related to these topics. So can we take the questions?
Please.
Sure.
Yeah.
So the first question is, of course, related to the current scenario, that stating that there is very high mortality associated with COVID-19. And so so there might be phobia in certain clinicians. So how can we handle this? Or what is the approach in these patients?
Okay. So two things. One, as I said, that for psychological and physical symptoms of anxiety or phobia, we have medicines, which I have already mentioned.
Yes, sir.
Apart from medicine, what we call cognitive behavior therapy. And there many times we talk about probabilities and possibilities. Everything is possible. It is possible that when we are now doing this webinar, suddenly there will be earthquake and everything in the Bombay will collapse and all of us will die. Yes. There is a huge hurricane or tsunami will come in Bombay and we all will die. These are possible things. But what is the probability? 1 in million, isn't it?
Yes, sir.
Similarly, if you see, mortality is not very high in COVID. As we know, that mortality in a young people is less than 1%.
Yes, sir.
Maybe 1 in 1,000 or 5 in 1,000. So there are 995 chances out of 1,000 that even if you develop COVID, you will survive. Majority of the COVID, and I can tell you my own experience that I had taken COVID vaccine in January and February this year. In spite of taking in April, I had COVID. But luckily, I had fever only for 2 days, 100 degrees. My COVID antigen test was positive. After a week, RT-PCR was positive. But I did not have any symptoms except fever for 2 days. And I completely recovered in 2 days. And my test also recovered after 2 weeks. I was only quarantined for 17. Luckily, I got 17 days of leave. Because what has happened because of COVID, our regular summer vacation was cancelled. So it was a blessing in disguise for me that because I developed fever for 2 days. Otherwise, see, if COVID wouldn't have been there, you have a viral fever for 2 days and third day you are on the work.
Yes, sir.
Luckily, my COVID was positive. I did not have any symptoms. So I was isolated and quarantined for 17 days where I could do whatever I wanted to do. Free time for me, vacation for me. So I think there are cognitive behavior therapies. There are ways of thinking. And if you think it this way, that COVID is not a lethal illness in majority of the patients. There is a possibility, yes, that people can die because of COVID, particularly if they develop cytokine storm, etc. after 2 to 3 weeks. But the probability is 1 in 1,000. So then that might reduce your anxiety.
Thank you, sir.
Yes.
So the second question is related to continuing the same format. There is also apprehension among family members of the doctors who are managing COVID-19. So how can we handle that effectively?
As I said, if it's a normal apprehension, it is good. So when the doctor from the hospital work comes home, immediately he will go to the bathroom, remove all his clothes and put it in a bucket or a washing machine nowadays, take bath properly with a soap, etc., wear new clothes, and then come out and socialize or mix with his family members. So because of this fear, he's taking precautions. Similarly, all the family members will also take precautions whenever necessary. They will put the mask properly. It is very, very important to put mask from here to here and cover yourself completely. Though it may not be very, very comfortable, but still it is necessary that wherever you go out, put your mask properly. Otherwise, while talking, you remove your mask and start talking, and again you are spreading COVID.
Yes,
So
sir.
put the mask properly, sanitize regularly your hands and whatever other things are required, and social distancing. And because normal apprehension, it is good that you will take all these precautions and you will save yourself from COVID. But if there is an overwhelming anxiety, then yes, we can do counseling for that patient, either on webinar like this kind of thing, individually or in group. Nowadays, phone counseling or WhatsApp counseling is possible. There are a number of counselors who do this. And also, if necessary, if you have symptoms like insomnia, tremors, excessive sweating, palpitation, then yes, medicines are available to control these psychological and physical symptoms of anxiety.
Thank you, sir. So there's one question from Dr. Deepa Nair, ma'am. The question is, which antidepressants are safe in actively COVID-19 patients?
What we have found, and in fact, we have treated actively COVID-19 patients with antidepressants, and we have tried escitalopram, which is the dose titration is easy, 5 milligram, 10 milligram, 20 milligram. And even actively COVID patients, if he's terribly depressed, otherwise you can wait. See, depression is not life-threatening. But if he's suicidal, yes, we have treated patients having COVID positive state with escitalopram or any other SSRI. Certain SSRIs you may not want to use, like fluoxetine, which inhibits cytochrome P450. So it will increase the other drugs or drug-drug interaction fear is there. But escitalopram, sertraline is another medicine which one can use, but only thing, that it has a higher chances of nausea, vomiting, gastritis. But if the patient tolerates sertraline, well, that can be used. If you don't want to use SSRI, then doxepin, dothiapine are there, which can be safely used in this patient. So antidepressants, any of these antidepressants can be safely used in patients having active COVID illness.
Yes. Sir, continuing with one more complaint related to COVID, that is related to sleep, sir. So that is all. We have got a question on how to manage sleep disturbances and also the medications that can be used during COVID and post-COVID.
Yes, yes. Sleep is very, very important, and sleep is an important health parameter.
Yes.
So आप घोड़े बेच के सो रहे हो तो आप healthy हो. But agar if you are not sleeping well, that is a first sign that you have some stress, you are going through stressful period, you have some psychiatric problem. So one is sleep hygiene. There are principles of sleep hygiene. So your room should be clean, comfortable, noise and light free. So that is one. Second, many people prefer to relax before going to sleep. Avoid using mobile computers continuously, bombardment of bright lights. Avoid that half an hour at least before going to bed. Some people prefer to have a bath before going to sleep. Wear loose, simple clothes, comfortable clothes. So there are some principles of sleep hygiene which you can follow, and that will improve your sleep. Avoid smoking and caffeinated drinks, tea, coffee, stimulants just before the sleep, at least 4 hours before the sleep. So there are a number of principles of sleep hygiene which one can follow. Apart from that, if still you have a problem, then we can start with melatonin. Melatonin is a useful medicine in some of the patients, though it is very, very mild. But for initiation of sleep, melatonin may be good. You have melatonin 3 milligram, 5 milligram, 10 milligram. Next to the melatonin, we have zolpidem, Z group of drugs. So zolpidem, zopiclone, zaleplon. So zolpidem is easily available nowadays. So zolpidem, you can give it for a few days, and then once you start sleeping better, gradually reduce and stop medicine. If zolpidem doesn't work, then you can go to little higher medicines like lorazepam, short-acting benzodiazepine, 1 milligram, 2 milligram, and that will help. If that also is not working in some patients, they come to psychiatrists and we give them more medicine which are usually not prescribed by family physicians like quetiapine or clozapine. So there are definitely sleep hygiene principles, mild medicines and severe medicines for sleep disturbances. And any of these medicines, depending on the need, one can use. Apart from this, yoga, relaxation, there are various other therapy, nindra therapy, etc. So those can be used along with these medicines if they are required.
Thank you, sir. So one of the other challenges that clinicians face is that, especially when clinicians go to work, the kids might be under stress. So how do we handle that?
Yes, it is very, very important because if kids do not really know what exactly COVID is, then obviously they are very, very frightened. I remember 26/11 when 2 planes crashed in Twin Towers in USA, and they kept on showing it again and again and again and again on TV repeatedly. Some children kept on feeling that this is happening again and again without realizing that it has happened only once, and they are showing it again and again. And they were so frightened, and they were asking their parents, why so many towers are being bombarded with so many planes. So it is very, very important for the parents to explain to the children that yes, there is an illness and we should take precautions, but it is not a lethal illness. We need not be excessively worried about it. Simple precautions are there, and if you take proper precautions, you are less likely to get this illness. But in spite of taking precautions, if you get illness, it is not that you are going to die. The chances of death is 1 in 1,000 or less than 1 in 1,000. So nothing to worry. Doctors are available, medical team is available, hospitals are available, treatment is available. So if the parents give them good support, good education, and take care of their various fears or wrong cognitions, children may have different ideas. So kind of address that, then you can reduce the children's fear.
Thank you, sir. Sir, we have covered phobia, depression, and sleep. So one question is, which are the other commonly observed complaints among clinicians during COVID-19 mental health complaints?
Okay, so one is exaggeration of obsessive compulsive disorder.
Okay.
Now, as we know, one of the most common symptom of OCD is washers. So they keep on washing their hands 10 times in a day, and there is a fear that of contamination, that they will catch some illness, and that's why they wash their hands 5 minutes, 10 minutes till they feel satisfied. Now in COVID, we are actually asking everyone to do so, that wash your hands properly and wash it many times in a day. After touching something, after doing something, please wash. And these people who have obsessive compulsive disorder, already they are washing excessively, and that further increases because of this COVID related fears. So yes, apart from anxiety and depression, anxiety disorders, depressive disorders, we have seen exaggeration of people having obsessive compulsive disorder.
So in the COVID-19 management, so there are few more questions, so we'll take more. So,
yes.
So mental health is also an important aspect. Do you think in the COVID-19 management, mental health is ignored and it should be part of comprehensive management?
There is no doubt that if patients having COVID-19 illness, or when they are recovering from COVID-19 illness, and if any of them have some psychiatric symptoms, they should be referred or treated for that. I do not think that any doctors are avoiding it or not recognizing it. I think majority of the doctors are aware. I work in Sion Hospital, and majority of our doctors are aware about it. And regularly, whenever required, they refer the patients. I would also think not only the patients, but even the relatives and doctors themselves. As I told you, these two doctors came to me themselves. Yes. So I think many resident doctors, many other patients, relatives come to me and saying that after COVID, he is not well. So what should we do? And after physician examines them properly, completely, and tells them that no, these are not related to COVID, or these are psychiatric symptoms, and you consult a psychiatrist, many of them without any hesitation, without any stigma, come to us and take treatment. And I fully agree with you that yes, psychiatric or mental health is a very important issue, should be taken care of along with COVID-19 treatment.
Thank you, sir. So we have got a query from Dr. Ajay Kumar, sir. Sir asked us that can we take paroxetine plus benzodiazepine together?
Okay, very good question. By and large, paroxetine itself has anti-anxiety effect, and also it's a good sedative. So many people with paroxetine itself get good sleep. As I mentioned, that sometimes what happens that when you give paroxetine alone, the paroxetine does not work on day one. So anxiety may not be controlled on day one, and usually the effect is seen in 2 to 3 weeks. So for rapid control of anxiety, some of us prefer to give benzodiazepine along with paroxetine. In fact, even combination of paroxetine and clonazepam is available in the market, to the extent that when you give it, there is a rapid improvement in sleep, rapid improvement in anxiety symptoms. And what we do, we are always worried about benzodiazepine addiction, that people might want to use it excessively or misuse it. So it is to be used and with a precaution. And once the anxiety is well controlled, we try to take off the patient from benzodiazepine as early as possible, so that he does not become excessively dependent on benzodiazepine. So yes, that precaution is very, very necessary. So if it is not necessary, please do not give benzodiazepine. You can give only paroxetine. But if in some case, if it is necessary, you can use benzodiazepine. That's your clinician's decision.
Okay. So there is one question related to any research or any studies that has been conducted during COVID-19 related to mental health. which can be implemented?
Yes, yes. There are studies, and in one of the studies, they have found that 1/3
Yes,
of
sir.
the patients, 30% of the patients who have suffered from COVID illness have mental health issues. And majority of them have this anxiety symptoms, depressive symptoms. So yes, people have studied and kind of documented this phenomenon.
Uh, okay, sir. So we'll stop over here, sir. So before we end the session, any final suggestions or comments to maintain positive health among all clinicians and their family members, sir?
Yeah, I would say that psychiatrists are usually considered as पागलों के डॉक्टर, वेडे यांचे डॉक्टर. Yanche is very, very important. It's not Vede doctor, Vede Yanche doctor, Vedyanche doctor. So psychiatrists are usually considered as people who treat psychotic patients or Pagaloke doctor, but that is a myth. If at all psychiatrists are to be labeled with their illness, then it should be depression ke doctor, anxiety ke doctor, chinta ke doctor. And if anybody has anxiety, depression, I think most of the family physicians can treat it. It's not this thing. Most of the physicians, cardiologists can treat psychiatric disorders. It's not very difficult task when they are treating their cardiac illnesses, when they are treating their physical illnesses. They can also treat anxiety disorder, depression, and they should consider and treat these patients. If the patient presents with panic disorder, instead of saying नहीं आपको कुछ भी बीमारी नहीं है, हार्ट का बीमारी नहीं है, tell them that yes, heart की नहीं है, but panic disorder है, मन की बीमारी है, go and meet a psychiatrist. So either they should treat identify psychiatric disorders, help the patient and treat psychiatric disorders, and if they feel that a patient requires consultation from a psychiatrist, please refer these patients to counselors, psychiatrists, and help them. Please don't have any stigma against psychiatry.
Okay, sir. So with that, sir, I would like to thank you on behalf of Sun Pharma and all the audience who have joined us in this webinar. I thank you for providing your enormous experience and also your providing valuable feedbacks on the various questions or also the topic that we covered today, sir. Once again, thank you. Along with that, I also thank all the audience for taking their time out and attending this session. And we also thank the whole backend team of the Sun Pharma team and also the other technical team who is working on this webinar. Thank you all. Have a great day ahead and stay safe. Thank you. Thank you, sir.
Thank you, Sun Pharma. Congratulations for this Sunkalp initiative and wish you all the best.
Thank you, sir. Thank you all.